Good afternoon. It's Mark Larson here to talk about COVID-19 in Kittitas County. So we did not have any new positive cases today in Kittitas County, although we did have 3 positive cases come at the end of the day yesterday at about 5:15, all related to previous cases. All of our current cases are doing well, and more than half of our cases have recovered and have returned to work. So we're still monitoring people on a regular basis. We're still testing a lot through the COVID clinic at Kittitas Valley Hospital, and we are still doing case and contact investigations at the health department. So we are still doing our part. As you know, we got our variance to proceed into phase 2, and so please look at the governor's website in regards to what's allowed in phase 2. The other big news is yesterday afternoon, the governor put out some guidance which was directed from the Archdiocese in Spokane in regards to churches. And so churches starting this weekend can have services of people of less than 50 people indoors, and they can continue to have outdoor services. So I met this morning with most of the church leaders in Kittitas County. It was a very positive meeting, and they're just a great group of people. They're looking out for their members of their churches. Some of those people are not going to be ready to open this weekend. They don't really feel like they can do that safely in their facilities. They're still working on safety plans. So if you go to one of those churches, please do it online. If they're not open, they'll be communicating with you. Some of the churches will be open because they feel like they can do it safely, and that's a great thing. So let's go to some questions.
During what phase can I resume visiting my mother in assisted living or taking her for outings?
That's a great question. So I can give you some updates from this afternoon. So 2 weeks ago, the president said every nursing home resident had to be tested for COVID-19, and every nursing home employee had to be tested for COVID-19. So that went to the states. The states trying to figure out how they were going to really get that done, looking at testing, looking at cost of testing, looking at how to pay for testing for people that didn't have any health insurance. So this afternoon, the governor came out with guidance that is directing all nursing homes and memory care centers to test all of their patients and staff. There's a date on that, which I think is June 15th, but in the middle of June needs to be done. They will be sending those facilities the supplies, and the facilities will be testing their residents and their staff, and those will be then sent to the state to be processed. The reason for doing that is for us to get an idea of how much disease is actually in the nursing homes, which by doing that and then doing long-term care facilities such as our assisted living facilities in town, we will have an idea of how to release those restrictions. So until we have that testing done, there will not be the restrictions will not be lifted, but in the middle of June, we should have those results back, and we should be able to say, okay, well, we can start doing these things safely and allow residents to get out of their rooms, or residents to have visitors and those type of things, if we know how much disease is in those facilities. So that's good news. It's exciting. We know that families want to see their family members, and those people in nursing homes want to see their families. So that's a good thing.
Suncadia is advertising that they are welcoming guests back beginning June 5th. Pacific County has also announced that vacation rentals are allowed during phase 2. I understand that Suncadia has a hotel, but how can hotels welcome non-essential guests while I am banned from renting my property on 1 acre?
Yeah, so that's a hot topic. Again, if you live in Upper Kittitas County, you should reach out to Laura Oshatis, because she and I and the governor's office have been discussing that today and for the last few days. I've also tried to initiate some discussion with some of the Upper County vacation rental businesses, and I've not gotten a return call from them. And we did discuss it with the economic recovery group earlier this week. So reach out to Laura. She's trying to gather some opinions from her Upper County constituents as to what people really want. So I can tell you what I know. The governor has not really addressed specifically vacation rentals. What the governor did was said hotel workers were essential. So that's to allow somebody who is a respiratory therapist who is volunteering to work in the hotbed of COVID-19 disease in Yakima so they can stay in a hotel. So that's the reason hotel workers were that they were essential. They did not specifically address vacation rentals. So we're trying to get the pulse of people on vacation rentals, and Laura Oshadas is really wanting to know from those people in Upper Kittitas County, what do they really want? What do they really think is safe? How can we do that safely? And then we will address that together as a group. We currently have a restriction on Upper Kittitas County vacation rentals because we're not supposed to be vacationing. We're not supposed to be traveling out of our county of origin. So travel for non-essential things is not okay. And the governor's stay home, stay healthy. So we're trying to work that out. And please reach out to Laura via her email through the county and give her her opinion in regards to that. Your opinion, sorry.
If you participate in an activity with people outside of your household but maintain social distancing and or masking, are the participants counted as one of your 5 contacts outside your household?
They are. So anybody outside your household bubble is considered a person. And that's because you can't be absolutely sure you're not spreading disease amongst those people. Wearing a mask all the time is not 100%. Staying 6 foot away is not 100%. If you look at some of the videos in regards to when people cough, it goes a lot farther than 6 feet. One thing that changed yesterday, was the amount of time that you had to be close to somebody to be considered a close contact went from 10 minutes to 15 minutes. So we know you still have to be close, but you have a little bit longer period of time. And we know that the closer you are, the more likelihood you're going to be to be infected with disease. So yeah, that person that you go spend time with still counts as one of your 5 people for the week.
For COVID-infected individuals whose living situation does not allow them to effectively isolate without exposing co-inhabitants, does Kittitas County have a facility for them to recover in?
Yeah, so we don't really have one specific facility. So we did not say we're gonna buy a hotel or we're gonna build a facility down at the fairgrounds. What we do have is a group of churches, business owners, families that say we have this ability to take care of others within our organization. So for example, if a church would have somebody who was positive and they couldn't isolate from their family, we in public health would call that minister and say, hey, we've got your family member, your church member that's positive, they need a place to stay, and all of the churches have said they're willing to help out. So we have those things. We have some hotel rooms that we have the ability to book. We have a relationship with Central Washington University if we needed to use some of the dorms that are going to be empty this summer. So we have a variety of things. We have been really fortunate that we have not had to put people up outside of their homes, but as you noted in that question, sometimes when we stay in our homes, we do infect the people in our homes, and that did happen to some extent.
If the governor does not extend the stay-at-home order, does that mean those areas of phases 1, 2, and 3 get removed?
Yeah, so as that question points out, the governor's stay home, stay healthy order expires at the end of this month on May 31st. So I would expect the governor to do something with that stay home, stay healthy order, but I have no idea what that is. We also have a health order in Kittitas County, which is similar to the governor's order. So regardless of whether the governor says, I'm going to let this go away, or we say we're going to take the health order away, those phases are still going to be here because we know that the disease still marches on, that 14 days is the incubation period of the disease, and that extra 10 days has to do with lag of test results and data, so that's why the 3 weeks. So we know for sure, regardless of whether the governor says it or whether the president says it or whether we say it, we know that it's going to be 3 weeks at least between phases. Those phases will change, so the things that are allowed in those phases will change. For example, the church opening thing, that was not supposed to be until phase 3. It was decided yesterday when we went into phase 2. So those phases will change, but they'll still be in place for quite some time. And I would guess, based upon the data, that some counties will still be in phase 1 by the end of the summer. I think it'd be really difficult for Yakima to be out of phase 1 until the end of the summer or before the end of the summer. I think it'll be hard for King County to be out of phase 1 before the end of the summer, and I think it'll be really difficult for all of us to be into phase 4 before the end of the summer. That will probably require a vaccine. So that said, to move forward in the phases, the most important thing for us to be doing is to stay home, wash our hands, stay home especially when we're sick, wear a mask when we can't be further than 6 feet from others, and make sure that you're taking care of others. Thanks a lot. We'll see you tomorrow.